To most people, Carl looks like a healthy young man, but inside his chest, his heart is failing, and he is now under the care of the cardiology department at Community Regional Medical Center.
He was initially admitted to the hospital in May of this year with heart failure symptoms. And whenever there's a heart failure, we want to make sure they do not have any critical blockages. He has a long-standing history of high blood pressure, and he apparently was not taking medication, not taking care of himself. So these years of high blood pressure probably caused him to be in this situation. Hello there.
Hello.
How are you?
Good morning, Dr. Joshi.
Good morning, Larry.
Good morning, Dr. Joshi.
Dr. Bipin Joshi will use real-time x-rays to look inside Carl's failing heart.
All right, I'm going to go ahead and start. A little pressure for...
Cardiology tech Nicole Castillo keeps a close eye on the patient's vitals and the high-tech diagnostic devices.
Nicole, can I have X-ray, please?
The x-ray system has been activated, and Dr. Joshi is now ready to go.
Okay, here we go, Carl. Numbing medication coming up. A little burning and stinging. That's normal. You okay, Carl?
In the cath lab, Dr. Bipin Joshi is trying to figure out why his patient is experiencing heart failure.
Okay, you're gonna feel a little bit sharp again.
Dr. Joshi is performing a coronary angiogram. He begins by making a small incision in Carl's groin.
Okay, so I'm getting access to the artery with my needle. Gain access from the femoral artery, from the groin, and put our catheter all the way from groin to the chest, and then we cannulate your arteries and take pictures from different angles. The idea is to find out if there's any critical blockage which might be causing us symptoms, so sometime you fix those blockages, he may improve. His heart function may improve. Okay, we have access now, and now we're going to put our left coronary artery catheter. It's going over the wire. Okay, we're looking under the camera where our catheter is going.
A catheter is a thin plastic tube. In this case, Dr. Joshi is using it to look for blockages.
Okay, I'm going to start taking pictures now. This is on the left side. Here we go. Okay, now camera's going in different locations, so we take pictures from different angles. How you doing, Carl? Sleepy? Feeling okay so far?
Carl is in the cardiac cath lab getting an angiogram.
Okay, I'm going with the right catheter. This is going to be on the right side. We'll take a picture on the right coronary artery.
Dr. Joshi is looking for blockages in Carl's arteries that could be causing his heart failure.
Okay, Carl, you're going to feel a bit warm. Carl?
Yeah.
Okay, the next picture will make you a little bit warm.
You ready here?
Ready?
We're looking at the EDP on the patient.
EDP measures how well the heart is pumping blood to the body.
This is not normal. It doesn't pump. So usually people with normal EDP is from 5 to like 12, and his EDP is 30 or higher. LV systolic pressure is unchanged. Let me get another EDP. So it looks higher than that, just like 37.
I'm going to put a little pressure and then put a little stitch. Okay?
The cath lab procedure is now over, and Dr. Joshi has good and bad news for Carl.
No, he does not have any blockages. So that's a good news. But the bad part is that his heart is enlarged and only 15 to 20% functioning.
Carl has just received a coronary angiogram. Dr. Joshi didn't find any blockages, but has confirmed that Carl is experiencing heart failure.
Well, he's doing fine. It's okay to talk here?
Yeah.
Okay. So he's doing fine, and he has no blockages. So that's good news. But as you know, his heart is a little enlarged, and it's kind of not that strong, it's weak. So we'll give him some medication to take care of that, and then see the response, how his heart reacts to the medication. If medication helps him, fine. Sometimes medication may not help, and heart may remain weak. If it remains weak, then he would need a defibrillator. You know what that is? It's like a pacemaker kind of thing, which has a sensor which senses his heart 24 hours a day, 7 days a week. And if it senses fast heartbeat, it can give it an electric shock. It's a kind of safety device. As far as this procedure is concerned, he's doing fine. No problem with the blockage or anything. So you have any questions?
Is he gonna be disabled though?
You know, based on his heart function, looks like that he may be at this point, and we'll see after medication how he does. But at this point, I think he probably is disabled. On the way his heart is like 15–20% functioning, it'll be difficult for him to carry on his day-to-day, you know, especially work. All right? Okay. Take care. All right.
Again, thank you very much. It's great, but the only thing sad part for me to hear him say that he doesn't want to be at home. He wants to work, more or less. I mean, it's gonna be hard, but I think he can do it. He will do it, more or less. It's gonna be hard, but that's okay.
But he needs to, though. So if he's gonna get better.
Do you feel a sense of relief? No?
Yeah.
What's the patient's name?
He's an 820, they said. Let's see. How are you feeling?
Fine, just tired.
Right. How's your groin doing?
It's good. She just came and checked us. She said it's been
So it looks good?
Yeah.
Okay, on the angiogram part, I think I talked to your mother and her that you do not have any blockages. So your arteries are clean, but your heart is enlarged and now it's pumping strong. It's pumping like 15–20%. So we call that condition as a congestive heart failure and the cardiomyopathy. There's a medical name for that. So what we'll be doing, we'll give you medication over like few months and see how much it recovers. Okay, sometimes take medication. What it does, it kind of stabilizes your heart so it doesn't get worse. Okay, and we're hoping that it gets better. Okay, if it remains below 30–35%, then we put a safety device known as defibrillator. I think I talked to them about that. So we have to consider that. So what I'll do, I'll see you in my office next week, and then we'll go over more in detail as to what we'll be doing. So I'll see you next week then in my office. All right, and good luck to you.